In this video, I'm going to go over 10 signs that your body is in the menopause transition, and I'm going to share something that happens in my own practice that I think will surprise you. You notice your periods have changed. You can't sleep. Your heart randomly starts racing for no reason. You have gained weight around your middle, even though nothing in your diet has changed. Your ears are itchy for no clear reason. Everything at work takes so much more effort than it used to. You sit down to focus and just can't. And you feel like a different person, anxious, foggy, irritable in ways you don't recognize in yourself. So you see a cardiologist for the heart, an ENT for the ears, a neurologist for the memory problems, maybe a therapist for the mood, and nobody, not one of them, says the one word that explains all of it: perimenopause. I'm Dr. Barron, a board-certified endocrinologist with over 2 decades of experience. I treat hormonal disorders every single day, and perimenopause is one of the most missed and misunderstood transitions I see in women. Before we get to the 10 signs, I want to explain that perimenopause has 2 stages, early and late, and understanding both will help you make sense of your symptoms. The Menopause Society uses a staging system called STRAW, the Stages of Reproductive Aging Workshop, to define these 2 stages. Early perimenopause begins when your cycle shifts by 7 days or more from what is normal for you, and it happens more than just once. So if your period used to be every 28 days, and now it's coming every 21 days or every 35 days, and that keeps happening, that is the first signal. One shifted cycle can be nothing, but when the pattern repeats, your body is telling you something. Your estrogen is not dropping yet. It's actually swinging up and down unpredictably. Those swings are what causes so many of the early symptoms. Late perimenopause begins when you start skipping periods altogether with a gap of 60 days or more. Estrogen is now falling more steadily, and symptoms tend to intensify. This stage ends when you've gone 12 full months without a period, and at that point, you've reached menopause. Now let's get to the 10 signs. Sign number 1. Most women assume that perimenopause means lighter periods. Actually, in early perimenopause, the opposite is often true. Remember, in early perimenopause, estrogen is not dropping yet. It's fluctuating up and down unpredictably. When it surges, it builds up the inner lining of the uterus. Thicker lining means heavier bleeding when your period comes. So, some women are surprised to find that their periods actually get heavier before they get lighter. Sign number 2 is breast tenderness. When estrogen spikes, it stimulates the breast tissue directly, causing swelling, sensitivity, and that deep, aching, or heavy feeling that many women describe. It can feel similar to what you might notice before a period, but it can last longer or happen at different times in the cycle than you are used to. This is an early perimenopause symptom. Your estrogen is not low yet, it is high and erratic, and the breast tissue is reacting to those swings. Sign number 3 is hot flashes and night sweats. This is the symptom most people associate with menopause, but it often starts during perimenopause, sometimes years before the final period. A hot flash is a sudden wave of intense heat that typically starts in the chest and moves up to the neck and face. It can come with sweating and sometimes a racing heartbeat. Most hot flashes last between 1 and 5 minutes. So what is actually going on? Estrogen has direct effect on the hypothalamus, the part of the brain that controls body temperature. When estrogen level starts fluctuating, the hypothalamus becomes oversensitive. It picks up on the smallest shift in temperature and reacts by triggering a sudden release of heat through the skin. This is the hot flash. At night, something similar happens. As you sleep, your body's core temperature naturally drops a little. In perimenopause, that small shift can be enough to set the hypothalamus off. You wake up sweating, and then as the sweat evaporates, you feel cold and start shivering. This is the night sweats. Hot flashes and night sweats can start in early perimenopause, but they tend to get worse in the late stage as estrogen falls more significantly. Sign number 4 is joint pains and frozen shoulder. This one surprises a lot of women. Estrogen has a powerful anti-inflammatory effect on the joints. When it starts fluctuating and falling, that protection goes away. Joints throughout the body, knees, hips, hands, wrists, even the spine, can become stiff and achy. Many women assume it's arthritis, and sometimes it is, but often hormones are a significant part of the picture. Frozen shoulder is far more common in perimenopausal and menopausal women than most people realize. The medical term for frozen shoulder is adhesive capsulitis. The connective tissue inside the shoulder joint has estrogen receptors. When estrogen drops, that tissue becomes less flexible and more prone to inflammation and scarring. Women often blame something heavy that they lifted or sudden movement, but what made the shoulder so vulnerable in the first place was a shift in their hormones. In my medical practice, something interesting happens fairly frequently. My husband is a rheumatologist, an arthritis specialist. We often have the same patients. They come to him for their joint pains and to see me for their hormones. And what we have seen time and again is that after starting hormone therapy, joint pains improves and sometimes resolves completely. Some women no longer need to see him at all. We both like to take credit for the improvement in the joint pains. He thinks that he cured them completely with one injection, but between you and me, it is mostly me and the HRT. Sign number 5 is heart palpitations. This one sometimes sends women to the emergency room, and I completely understand why. You're sitting or relaxing, not doing anything, and suddenly your heart is racing or fluttering in your chest. So it can be quite frightening. But low estrogen is one of the most under-recognized causes of heart palpitations in women in their 40s and 50s. Here is the science behind it, kept simple. Your heart has a built-in pacemaker called the sinoatrial node, or SA node. It's a small group of cells that sends electrical signals that tells your heart when to beat. Estrogen receptors exist in the SA node. Estrogen helps keep the electrical system stable and steady. When estrogen fluctuates and falls, that stability is disrupted. The results can be racing heartbeat, a fluttering sensation, or the feeling that your heart skipped a beat. Now, it is very important that if you're having palpitations that you see your doctor. A cardiac cause always needs to be ruled out first. But if your heart has been checked and everything looks normal and your labs are normal, then estrogen deficiency may be the explanation that nobody has given you yet. Sign number 6 is weight changes and belly fat. Estrogen plays a direct role in how your body stores fat. When estrogen is normal, fat tends to go to the hips and thighs. When estrogen drops, fat shifts to the belly. Women tell me all the time, I haven't changed anything. I eat the same, I exercise the same, but my pant size keeps going up. And they're telling the truth. It's not about willpower or habits. Estrogen also helps the body use insulin properly. When estrogen drops, the body becomes more insulin resistant, meaning it does not process sugar as well, and more of it gets stored as fat around the middle. Sign number 7 is insomnia. Sleep problems in perimenopause go beyond just being woken up by night sweats or palpitations, though those certainly makes things worse. Progesterone has a natural calming effect on the brain and helps promote sleep. As progesterone drops, that calming effect disappears. Estrogen also plays a role in sleep quality. When both hormones become unstable, falling asleep and staying asleep becomes a real struggle. You may find yourself wide awake at 3 a.m. with no clear reason. Or you may fall asleep fine but wake up repeatedly through the night. And poor sleep makes everything else worse. Mood, energy, weight gain, joint pains, and ability to concentrate and think clearly all gets worse. Sign number 8 is dryness everywhere. Estrogen receptors exist throughout the body, and when estrogen falls, dryness can show up in many places. Skin becomes dry and itchy. Eyes can feel dry and irritated. Some women notice nasal dryness, and one that rarely gets mentioned is itchy ears. I've had patients who spent months seeing specialists for what they thought was an ear condition or allergies, and the real issue was estrogen loss. Vaginal dryness and thinning of the genital tissues also affects the bladder and the urethra, leading to urinary urgency, frequency, and sometimes recurrent urinary tract infections. Sign number 9 is mood changes. Estrogen affects serotonin, dopamine, and GABA, the brain chemicals that regulate mood, calm, and emotional stability. When estrogen becomes unstable, those systems become unstable too. You may feel anxious in ways you've never been before, irritable, easily overwhelmed, or have a low mood for no clear reason. And not surprisingly, surprisingly, mood changes don't just affect the lady going through perimenopause, it affects the people around her. I have had patients come back after starting hormone therapy and tell me that their husband is thanking me, their kids are thanking me. Teachers tell me that their students are relieved. Co-workers say the tension in the office is gone. And most importantly, the women themselves are happy to feel like themselves again. Sign number 10 is brain fog, memory problems, and worsening ADHD. Estrogen supports the brain in many important ways. It promotes blood flow to the brain, supports memory pathways, and helps with concentration and processing speed. When estrogen becomes unstable, you feel it cognitively. You're in the middle of a conversation and your thought just vanishes. You sit down at your laptop, and by the time it opens, you have absolutely no idea why you're there. You start a task, get distracted, start another one, and somehow finish neither. You used to be sharp. Now you're working twice as hard just to keep up. This is not early dementia. This is what happens when estrogen, a hormone your brain has depended on for decades, starts to fluctuate. For women who already have ADHD, this stage can be particularly rough. Estrogen supports the brain's ability to focus and stay organized. When it starts fluctuating, everything that was already a little harder becomes significantly harder, even if the ADHD was well controlled before. So what do we test? A lot of women come to me confused about FSH. They had it checked, the results came back normal, and their doctor told them that they're not in perimenopause. I see this all the time, so let me clear this up. FSH, which stands for follicle stimulating hormone, is a hormone made by the pituitary gland in the brain that tells the ovaries to work. As the ovaries age, FSH tends to rise. So yes, a high FSH supports the diagnosis of perimenopause. But a normal FSH does not rule it out. During this transition, FSH bounces around dramatically. It can be high 1 week and normal 2 weeks later in the same woman. One normal result on one random day does not mean that we are not dealing with perimenopause. Perimenopause is a clinical diagnosis. That means it is based on your symptoms and your cycle history, not a single blood test. The exception is women who cannot use their cycle as a guide. If you have had a hysterectomy, your uterus has been removed, so you have no periods to track. If you have had an endometrial ablation, the uterine lining was destroyed, so bleeding is no longer reliable. And if you're on birth control pills, your cycle is controlled by the pill, not by your own hormones. In all of these cases, blood tests, including FSH, become much more important because the menstrual history is simply not available. It is important not to automatically assume that every symptom is perimenopause. Other conditions can cause the same complaints, and some of them are very treatable. If sweating is the main complaint, I check thyroid, IGF-1, and for other conditions. An overactive thyroid can cause excessive sweats. A high IGF-1, which reflects excess growth hormone, is a cause of sweating that can get missed for years. If palpitations are the main complaint, the first step is to see a cardiologist to make sure the heart itself is fine. Once that has been cleared, I look at the thyroid, magnesium, thiamine, CBC, and iron. Anemia is a surprisingly common cause and easily missed cause of heart racing, and low magnesium and low thiamine both affect the way the heart's electrical system works. If irregular periods are the main complaint, I check prolactin and thyroid. Both can disrupt the cycle in ways that look exactly like perimenopause, but are completely treatable once identified. Once everything else has been ruled out and we are confident that we are dealing with perimenopause, we can talk about treatment. And there are many options. Some women do well with progesterone at bedtime by itself, particularly in early perimenopause. Others need added estrogen, often as a patch or a gel, which I generally prefer over oral estrogen. For vaginal dryness and urinary symptoms, vaginal estradiol or estriol or vaginal DHEA works very well locally without significant systemic absorption. Some women also benefit from testosterone for energy, lean body mass, and libido. And for women who have contraindications to hormones, there are options we can discuss as well. I have a full video on menopause and hormone therapy that goes much deeper into treatment options. This is the link for it. If this video was helpful, please give it a like. It helps other women who need this information find it. Also, please subscribe so you don't miss what's coming next. This video is for educational informational purposes only and not medical advice. Always work with your own healthcare provider for your specific situation. See you in the next one.